The critical piece is how do people get to where services are? The one thing that we've seen a lot over the last generation in particular, or the last couple of generations, is how providers have moved out of the inner city, where most of services used to be downtown, and now they're not. And so when doctors and dentists and other providers move out to the townships, people simply can't get to services. And so there's just that disconnect. Accessibility is that, in the sense of from a disability perspective, often we look at the front door and then can you get around the office, but we don't necessarily look well enough at the distance or the how do I get from my front door to the doctor's office front door or the hospital front door. And so the issue there becomes that people can't access education, they can't access follow-on services. How hard is it to get to your doctors? And so if you're spending all day just getting somewhere, it just makes it harder to live a healthy lifestyle. Well, the biggest barrier is again, since the Second World War, we've built the world for cars, and we've built the world in such a way that my mobility is required for me to jump into a car. And so to say, well, in the good old days, you would walk to the grocery store. Just that little bit of exercise adds up throughout the course of a day. But now I walk to my garage, walk to my driveway, drive to the store, park as close as possible, walk in, just all of those opportunities to get. Again, you can jump on a treadmill and walk a couple, 3 miles, or you could just live life in a built environment where walking is either required or walking at least is allowed or encouraged. I happen to live in Easttown, and so to walk a few blocks, I can go to restaurants, bars. I don't know how healthy either of those are, but to different stores, visit friends, go to parks. So all of those things where, again, it's just things at some level to say if things can just happen and almost accidentally, as opposed to, you almost have to plan a whole day trip just to go to the park with the kids. For us, we just walk to the end of the block and we're at Wilcox Park. And so really looking at how does the built environment lend itself to things just happening. Right now, the only thing that just happens are car trips. The most important thing is looking to see how we're incorporating pedestrian facilities, bike facilities. So, you might be a subdivision in Rockford, but if you're a half mile or a mile from the intersection of 10 Mile and the East Beltline, would you even imagine walking there or taking your bike or taking your, again, you're on a bike and your 5- and 6-year-old are on their own bikes. I don't know what kind of sidewalks or bike paths are out there. And those are the kinds of things we should be having, again, so that the family's there. You don't have to load everybody into the van to drive a half mile to go to the store that's right there at that major intersection. And it's the same thing, pick the community around the county. How are we making sure that all of these options are there and, accidentally we'll get some exercise in?
Okay. Next question. What's the lived experience of health for the clients that you serve?
As people with disabilities, to say that the stereotype is of course, they're heavy users of health services. That may or may not be the case. One of my coworkers, as we're taping this, she's in Dallas for a wheelchair tennis tournament, so she's in way better shape than I am or ever have been, but she sits in a wheelchair. And so the first to say that making sure that we're treating the person first. Just because a person has a visible disability, that doesn't necessarily mean they have health issues. And so again, from a health profession perspective, are you really honoring the person and the story they bring? And then unfortunately, as people become higher users of the services, sometimes it may not be from the professionals, but it may be from the paying parts of the system, in the sense that Medicaid, Medicare, private insurance, how are we, I guess if it's the right term, but to say that we're the loss leaders, because we're the ones high utilization, and how does that impact treatment throughout the system? I think the first thing we have to do is to be aware of the fact of how unequitable it is. For the vast majority of people, well, at least I hope it's still the vast majority of people, we have health insurance, and to know that at some level, if you're not feeling well, you hope you don't feel that you can't go to the doctor, that you can't go because you can't afford to go, as opposed to, I don't want to go because I just don't like doctors. I mean, there's different issues about what would prevent somebody from going to see the doctor, but is that thing that's preventing them external to themselves? And then the other thing, of course, is to really talk about what does it mean to have a healthy lifestyle. Too much of the conversation right now, at least on the policy level, talks about access to health insurance, not access to either healthy living or access to health care. And so again, they're making sure our terms are well defined, and then we can talk about, what are those basic levels that we want to provide for each other, and then, if people want to provide more for themselves, those options are going to be available as well. But it's really having that fuller conversation on what is the needed access to that care. Looking at just basic transportation, can people get to, for instance, the farmer's market when we have, the freshest, most locally grown organic produce, but if I can't get there? And if I can get there, can I get the produce home? Just those two trips could be an insurmountable burden for folks. And then the convenience of, again, prepared foods, that it's just easier to purchase things in a box. And part of it as well then is looking at what kind of housing conditions people live in. Do they have the adequate, just refrigerator and stove? Again, a lot of us may take that for granted. With folks with disabilities, what kind of accessibility do their housing environments lend themselves to? So there's just, when you start layering those pieces in, but that first piece, the transportation, how do I get to those healthier options? And right now it seems like the unhealthy options are the easiest ones and most convenient.